Hey everybody, my name is Mgrdichian, and I did my learning objective on the plague, aka Yersiniae pestis, and specifically I wanted to get into the specifics of prevention, safety slash treatment, and diagnostic tools, kind of like get into the diagnostic tools that we use for Yersiniae pestis. So kind of starting off, the symptoms, this is just kind of like a baseline, like symptoms that you should go and get, or you should call your doctor and see if you should come in to the hospital. But the symptoms that that definitely indicate Yersinia pestis, or enough that you need to go to a hospital, are hemoptysis, which is also coughing, uh, high fever, difficulty breathing or shortness of breath, abdominal pain, and chest pain. And that difficult breathing and shortness of breath can also be because of heart attack as well. So either way, you want to go to your health provider, you want to go to the call EMS and go to the hospital. And I also added a little blurb on the side of the transmission of Yersinia pestis as well. So for the most part, this is usually spread by infected fleas, also specifically the Xenophila chopus, and that usually results in the bubonic plague. And some other methods of infection include contact with contaminated fluid and tissues of plagued animals, which causes septicemic plague. And you usually see that in hunting scenarios or trying to move like a dead animal across the road. That's usually where you start to see these septicemic plague issues. And then also with contact with infectious droplets of human patients with pneumonic plague. So that, yeah, it would be droplet infection, which you would most want to worry about if somebody has been diagnosed with the pneumonic plague. So I'm going to skip down here to diagnostic tools. And so here are a couple of ways. There aren't many ways to diagnose the plague. However, the easiest way that we do it is drawing blood samples from swollen lymph nodes and identifying bacteria from that, and also taking a CBC, or a complete blood count, to account for the rise of white blood cells and other parts of the immune system response as well. And also, hospitals do pre-screen people and ask whether, if they do believe that this could be a case of the plague, that they identify whether they traveled to the Western United States or other endemic areas. And kind of moving on to treatment. Over here, the best treatment that, well, back in the day, they didn't have antibiotics and they didn't really know about it. But now we have all these very powerful and broad range antibiotics, streptomycin, gentamicin, doxycycline, or ciprofloxacin are all very, very useful antibiotics to help clear an infection. And this is you obviously want to use these antibiotics earlier on into the infection. Otherwise, other surgical interventions might be necessary as well. And that's also with people who are further along and develop gangrene. And also, just another one I want to talk about is when a person's condition is like deteriorating, you're usually, or not deteriorating, if they're a little bit past, like if they're hospitalized, then the hospital will definitely start them on intravenous fluids and also administer antibiotics through that route as well. And now for the safety and prevention like category right here. The first thing that the CDC recommends is that you want to keep fleas off pets by using pet controlled products and shampoos and all the different types of like hygiene products for your animals. And they also recommend taking your animal to a regular visit to the veterinarian as well to prevent this. When people are handling potentially infected animals, the CDC also recommends that we wear gloves, and that could also be with hunting as well, like I mentioned previously. Also, we want it, like I mentioned previously with pneumonic plague, you're able to spread Yersinia pestis through infectious droplets. So the CDC highly recommends that you wear a mask, whether it's a surgical mask or an N95, to prevent any further droplet spread to either the patient care provider or to family members. Um, we the CDC also wants people to reduce the risk of having vectors such as mice and other rodents to inhabit their house. So we can prevent that by reducing clutter, like removing piles of firewood, preventing food from dropping on the floor inside the house so it doesn't attract little mammals, and also just keeping like a tidy environment. Also, when you're going to hunt, camp, hike, they also highly recommend that you apply flea repellent in wooded areas. And of course, if you do feel like you have any of these symptoms or believe that you've been diagnosed with plague, then the CDC definitely wants people to stay at home and not travel unless it's completely necessary. And obviously, I have this little blurb on the very bottom right that says if you develop any emergency symptoms, seek medical attention immediately. And that's just part of the public health part of this poster. But yeah, I will upload the poster to Moodle, and I also will drop the uh, references below in the comment section or in the bio. But if you have any questions, please let me know.